Hi, I'm Dana Schwartz, Substance Use Disorder Team Manager for Family Service and Guidance Center. Welcome to our third and final real-world parenting video for the month of May. Our topic this month is substance abuse. So previously, we've talked about why kids use, how we can prevent them from using, and then also what we can do if they are using. And today we're going to talk even more about what that looks like if they're in usage and how we get them in help. So with substance use treatment, there's multiple different levels. The very first step in getting into any of those levels of treatment is going to be to have an evaluation done. That evaluation is a assessment of a child's life, looking at their physical health, their mental health, their social health, really all aspects of their life, to look and see what the consequences and the impact of their substance use is. As we move through those questions and develop a better understanding of how a youth is using, we have a better way of gauging where they need to be placed in treatment. Level 1 treatment, which is kind of the beginning of all treatment, is up to 5 hours a week of treatment. This treatment may include may include individual treatment, it may include group therapy, it can kind of be a wide variety as long as we're staying at that 5 hours or less. As a youth is successful with that, we decrease the amount of time that they're engaged in treatment until they're weaned out of treatment completely. They may also, if they have co-occurring disorders, meaning if they have depression or anxiety or even ADHD or other diagnosable disorders that go along with their substance use, they may also continue to see their mental health provider while they're in treatment. If a youth cannot be successful at level 1 and needs more time in a therapeutic setting, we move into a level 2 treatment. Level 2 treatment is just that. It's more than 5 hours a week. It allows a youth to be involved in more groups, more stable and structured events to help gain sobriety and gain some feet under them while they're moving through recovery. If at any point in time a youth continues to use while they're still in the intensive outpatient or level 2 program, then we also look at residential treatment. Residential treatment can be up to 28 days, and a client lives in the more stable and structured environment. This decreases their chances of getting involved in usage. It allows them to gain some sobriety and get rid of some of the first initial struggles that they have in a stable place. If a youth is successful at completing residential treatment, they typically will come back to us and then step down into level 2 and then down to level 1 so that we're not just immediately taking away all of their supports. There are also many other important community resources that can be helpful for our youth and family members. There's 12-step support groups, AA, NA, also Al-Anon for family members. It's incredibly important that as our youth are addressing their issues and getting into recovery, that our family is also looking at helping themselves. If one member of our family is sick, then that impacts all of the members of the family. Therefore, it's important that as the youth gets sober and joins recovery, that the family knows how to help them manage this and also sustain this. Other resources that can be helpful may be religious or spiritual groups, such as Celebrate Recovery. It can also be helpful to get them involved in positive social places, such as Boys and Girls Club and other athletic or social groups. Including as many healthy supports for our youth in recovery is such a huge part of their recovery. As we take away the negative aspects of their life, we need to fill those areas with positive, and the more positive solutions that we can have for them, the more successful they will be. And that's all I have for today. I hope you'll join me on Thursday from 6:30 to 7:30 for our May Real World Parenting Zoom question and answer about substance use. To register, please follow the directions in the comments below. The Q&A is free, but you have to register to get the Zoom link. I'm Dana Schwartz, and thank you for watching, and I'll see you at the Zoom question and answer next Thursday. Thank you.